Rabies kills 59,000 people every year, 49% of them being children. It is a virus that affects the nervous system of humans and other animals. This virus enters through scratch, bite, eyes, nose, and mouth and can kill a person within months.
Some of the symptoms of rabies, such as fever, headache, and tingling at the exposure of sight, rabies travels through the body along neurons, attacking the central nervous system, producing symptoms to aid its transmission. As it reaches the brain, it causes inflammation, disrupting the normal communication of neurons, leading to one of the two forms of the disease known as furious rabies. Under the condition of furious rabies, characteristics such as violent movements, hyperactive behavior, insomnia, anxiety, terror, hallucinations, and fear of draughts and fresh air are observed. Paralytic rabies is the second form of the rabies. Under this form of rabies, the victim becomes depressed, lethargic, and paralyzed before entering a coma. Both forms of rabies cause excessive salivation forming in the mouth, hydrophobia, and difficulty swallowing, leading to the inability of swallowing excess saliva, which increases the risk of transmitting the disease to others. When the brain damage of the patient becomes too severe, the patient will either die from a heart arrhythmia, suffocation from muscle spasms in the diaphragm, or they drown in their own saliva. Having understood the importance of the topic, we felt the need to tackle this issue. We had set out to encourage a change in actions, emphasizing the severity of the issue and raising awareness on the topic. Our first step was to see the knowledge of our general public that it had about our topic.
Rabies is a virus that is transmitted through animal bites. It is mostly transmitted through mammals.
Well, I know that rabies is a deadly virus and it's transmissible through the bite of mammalian animals that have already been afflicted by the disease.
I think rabies is a disease that is found in humans after being bit by a dog, and in particular I only know that it's transmitted after being bit by a dog. I know it's a disease. I do not know much, but I know that it happens when you get bitten by an animal which is affected by rabies.
So I think rabies is it's a viral infection that usually occurs in dogs, and it alters their behavior in a manner that they become aggressive. So it's a virus that, according to my deductions, it deteriorates the brain. So I guess, yeah.
Rabies is a disease which is caused by bite of an animal who have been infected with the rabies virus. Mostly these are dogs, but can be cats, bats, raccoons, and foxes.
I know rabies is a viral disease and it is transmitted through animals which also have the disease. Some examples are like dogs.
No, I don't think so. Not anyone in my immediate family or friends, no.
No, I'm not aware of anyone who's been bitten. No.
I personally don't know anyone who's been bitten, but I've heard tales since a child that usually of how it's about rabid dogs and how it's transmitted by rabid dogs.
When I lived in Pakistan, I heard from a family friend that they got bitten by a dog who had rabies, and then they had to get injections for it. But personally, in my immediate family, I do not have heard of anyone having rabies.
Very often, as there are lots of rabid animals on the streets.
Well, I think in my country in general, I have heard of it a few times, especially when I started recently keeping pets. So then I did some research on the topic, and then the cases of rabies, they started coming on my social media homepages and all of that. So yeah, pretty often in that period, but I think it was just because the algorithm knew that I would be interested in such news. In general, like in daily life, I don't think I receive news of that very often.
I think in the past few months I've just seen like one or two posts on Instagram which are saying that a child or a person was bit, otherwise not very common. Not very often. I've not really much heard about it in our country, more on like a level where when I'm watching a movie and they tell that rabies or something.
I haven't really heard about cases.
I have not seen any case of rabies in my hospital so far.
We do not hear of rabies cases at all because it has been extinct in here since the last 100 years.
Yes, as soon as you come into contact with it, you should run as far away as possible and contact someone who is in authority.
In general, yes. In the same way that you get away from any stray dog that might be chasing you, you run, you seek higher ground, you seek protection from someone who might be better armed. You may use a stick or something to ward it off. But I do know that rabid animals tend to be more aggressive than regular strays, so I'm not really sure how that will work out in a practical situation since I've yet to experience it.
The knowledge that I have is that we should run away from them and just stay away from places that you are aware, stray animals are found there. No.
I haven't really encountered a rabid dog or animal, but if I were to, I would try to evade them as if a zombie is attacking me and I know I need to get away from it. Because if I get bitten, I'm gonna be a zombie.
Rabid animal has some specific feature. The infected animal looks very furious, anxious, and tongue protruding out with drooling of the saliva. If someone sees such an animal around, he or she should stay away from such an infected dog as much as possible.
No, because we do not have in here we do not learn about such diseases which have been extinct. So personally, I do not know how to get away from a rabid animal.
Take them to the hospital as soon as possible. I think we should encourage them and take them to the hospital immediately and get professional help instead of treating it at home and using, medicinal like herbal methods. I guess you would go to a doctor, but I don't know what the doctor will tell you.
When any patient presents with a bite, the wound should be cleansed with soap and water and seek urgent medical advice for post-exposure prophylaxis.
From the stories I've heard, the first thing you should do is go to a doctor and they give you injections for you to be safe from the virus. Yeah.
Hello, my name is Pawita. I am from Thailand and I go to KIS International School. So for the first question, do you know rabies? I know that it's a disease. For the second question, what do you know about rabies? I know that it's a type of disease, but I don't know much more about what it is. The third question, do you know anyone who's been bitten? No, I do not know anyone. For number 4, do you think it is deadly? How deadly on a scale of 1 to 10? I think it will be around 7 to 8. And for number 5, do you know how to get away from a rabid animal? I think you just slowly back away if you ever encounter it. And for number 6, which animal transmits rabies? I do not know. And for number 7, do you know what to do in case you or someone are bitten? I think that if me or someone are bitten, I would call for an ambulance and get them to the hospital as soon as possible.
Furthermore, we interviewed a general surgeon working at Ashraf Hospital, Sargodha, डॉक्टर हाफिज अशफाक अहमद।
ये ऐसे है ना कि जो रेबीज है ना, ये एक वायरल डिजीज है। सबसे पहले आपको ये पता होना चाहिए कि रेबीज जो फैलती है ये वायरस से फैलती है। तो ये जो मेनली ये डिजीज है ये मैमल्स की है, मतलब है कि या ऐसा समझे कि वाइल्ड एनिमल्स की है, जैसे डॉग्स हैं, कैट्स हैं, काउज हैं, हार्सेस हैं, ठीक है, और बैट्स हैं, इनमें होती है। ये आपस में इनका सर्कल चलता रहता है। तो ह्यूमन बीइंग्स में ये तब आती है जब इनमें से कोई जानवर जैसे कैट्स, डॉग्स, ये जब काटते हैं ह्यूमन बीइंग को और वो ऑलरेडी वायरस उनमें मौजूद होता है, तो फिर वो ह्यूमन बीइंग में ट्रांसमिट हो सकती है, ठीक है। और इस सिलसिले में स्पेशल तवज्जो जो है ना वो पेट्स पे होती है कि पेट्स जो रखे हुए होते हैं आपके, उनको आपने ख्याल रखना है कि वो तो रैबिड नहीं है। रेबीज भी एक वायरल डिजीज है, तो इसको हमने प्रिवेंट करना है। प्रिवेंट कैसे करना है कि जो हमारे इर्द गिर्द के जितने स्ट्रे एनिमल्स या ऐसे आवारा से डॉग्स, कैट्स स्ट्रीट्स में फिर रहे हैं, उनको कम से कम किया जाए, उनको जो है भगाया जाए या म्यूनिसिपल कमेटी के जरिए उनको मारा जाए। जो डॉग जिसने काटा है उसके काटने से लेकर उस बंदे में वो अलामात अपीयर होने तक एक टाइम पीरियड होता है। उस टाइम पीरियड के दौरान ही आपने उसको प्रिवेंट करना है कि उसमें अलामात जाहिर ना हो। ठीक है, तो अक्सर शुरू में जो अलामात होती हैं वो फ्लू लाइक ही होती हैं उसमें। ठीक है, फ्लू लाइक सिम्टम्स होती हैं, वीकनेस होती है, कमजोरी होती है, और सबसे एक बड़ी अलामत होती है जिसको हाइड्रोफोबिया कहते हैं। तो वो बंदा जो है वो पानी से डरेगा। तो ओवरऑल दुनिया की जो डेवलप्ड कंट्रीज हैं उनमें तो इन्फेक्शियस डिजीजेस पे बहुत ज्यादा कंट्रोल कर लिया गया है। तो पाकिस्तान या जो अभी अंडर डेवलप्ड कंट्रीज हैं या इस तरह के जो ममालिक हैं उसमें अभी ये बीमारी मौजूद है।
Regarding pets, we interviewed Dr. Muhammad Umar Iqbal, a veterinary physician at Faisalabad.
From the clinic, mostly animals like dogs and cats come, but if you go on a larger scale, the dairy farms, they all get their animals vaccinated from rabies. Everyone is coming willingly. The person who's bringing their cat or dog for vaccination, they know about the diseases, they know about about rabies, so they're all coming willingly. Because vaccination has increased in Pakistan, if we go back around about 10-12 years back, yes, there were cases of rabies. Their frequency was more if we go 10-12 years back, but now currently most of the people, they're vaccinating their animals, so it's a once in a blue moon that you see a rabid animal. The cases have decreased a lot. Vaccination, it's very important to keep your animal safe from rabies, but if you say that other ways except vaccination, then the only way is keep your animal strictly indoor. It doesn't have any interaction with animals from the outside. You can say stray dogs or stray cats, because rabies spreads through bite. And if your animal is strictly indoor, it doesn't have any interaction with other animals, that's the only way we can reduce it. We can't completely stop it by this way, we can reduce the chances of rabies. If we talk about symptoms, there are two stages of rabies. Well, the first one is called dumb stage and the second one is called excited stage. In dumb stage, the animal just confines itself to a corner, it gets scared of everything. Okay, it will avoid interaction with even its owner. That is the dumb stage. And if we talk about excited stage, the animal gets aggressive, it tries to bite everyone around him, even the owner. If you put it on a chain, it will bite the chain. And there's a misconception in our country, in this area, that a rabid animal, it's scared of water. No, it's not scared of water. In rabies, what happens? Pharyngeal paralysis happens and the animal can't swallow water. It tries to drink water but it can't swallow it, and it appears like that the animal is scared of water. No, it's not scared, it can't swallow water. If you say that it will spread like this, that the animal has eaten from a bowl and the other animal eats from that bowl, no, rabies doesn't spread like that. Rabies spreads through bite. When the animal bites the other animal, that's how it spreads. There are signs and symptoms. We can say that through signs and symptoms we can diagnose rabies, but there is no laboratory tests for that. Okay, the only way is when the animal dies or you put it down, you just chop its head off, bring out the brain. What does the rabies virus do? It produces negri bodies in the brain, and you can only diagnose rabies through those negri bodies, and you need the brain of the animal. Send it to the lab and then they diagnose it. Okay, cats and dogs, the initial vaccination age for rabies, it starts from 3 months. We give one shot, we give a booster dose after 21 days, and annually. When the cat is 1 year old or the dog is 1 year old, then we give a shot of rabies. When it's 2 years old, then we have to give an annual shot. First shot at 3 months of age, repeat it after 21 days, and then annually the vaccination is repeated. Yes, rabies is deadly, because once an animal has acquired rabies or a human has acquired, there is no treatment for rabies, and we would say that on a scale from 1 to 10, it's a 10, surely.
After all the secondary and primary research, we all started working on our outcomes. A lot of effort was then put into the seminar that was held on 21st February 2023. We conducted an interactive seminar in which all the content was presented. Students were also shown the cultural perspectives that were taken. This made the students have a better view of the topic, which helped them grasp a better understanding.
Who's willing to answer? Okay.
Rabies is a disease that can get into animals and then can transfer to a human. For example, if an animal who has rabies can act very abnormally, and if that animal gets injured and a human touches it, it might catch the rabies.
Alright, that's good. That's pretty good knowledge. Okay, but it's kind of unexpected to see किसी भी एक बंदा मिलेगा. Okay, कोई मसला नहीं. हम इसलिए सेमिनार कर रहे हैं ताकि आप लोगों का नॉलेज लेवल इंक्रीज हो और आप लोगों को पता चल सके ये किस तरह की डिजीज है और क्या क्या हम कर सकते हैं इसके लिए. Okay, so I just want to ask another question. ठीक है. अब इधर which one of you thinks it's actually dangerous? कि एक बंदा मार सकता है ऐसे? Is it dangerous or not? Yes, still hand raise. So sorry. Okay, ठीक है.
You have to isolate your pets from outside animals, ठीक है? So that is basically it, and you have to be very careful with animals.
How to prevent rabies?
How to prevent rabies? Stop your animals from outside animals.
Vaccination.
By getting your pets vaccinated.
Vaccination.
You can isolate your pets from like outside animals. If you cannot prevent it and if it's already there, then you just chop their head off.
Questions वगैरह किए थे, इसी तरह we asked different people. We conducted interviews, जो हम अभी आपके साथ शेयर करेंगे. अच्छा, we'll just do a overview, ठीक है? हम इतना ज़्यादा नहीं देख रहे हैं, थोड़ा सा देख लेते हैं, just to have an idea.
This is a virus that is transmitted through animal bites. It is
now अब आप लोगों को समझ आ गई है, right? What are the symptoms, how to prevent rabies and how to get away from a rabid animal. अच्छा, ये नहीं हमने पूछा how to get away from a rabid animal. क्या मतलब if you, हाँ, so what would you do in case case you're being bitten by a rabbit or वैसे अब तो हो गया ना, like नहीं you're आपको लग गया, अब now you're in your bed, ठीक है, अब आपने क्या करना?
I think we have to go to the hospital to get the wound checked, and then we will check, get tested, like blood test, and then we will get to know if we have rabies or not.
हाँ नहीं, but like ये preferably ये है कि आप लोग फौरन कंसल्ट करो डॉक्टर से, क्योंकि ये आप लोग now we all know कि वो बहुत deadly है, तो इसका as such इतना कोई वो भी नहीं होता solution.
We should follow doctor advice. Okay, so that's almost all of it. हम लोगों ने आपसे एक feedback form भी करवाना था, but we can't do that right now. But आज के दिन में ही थोड़ी देर बाद I think हम आप लोगों की classes को बुला लेंगे इधर IT lab में, and then we'll just fill this 5-minute form and then we'll be done with it. Oh, this कौन इधर बैठा वाला है? How many of you have a bed? Oh, okay. Okay, that's a lot less than I expected, but alright. But if you're ever willing to or planning to have a pet, these are something that you should know. Okay? First of all, this is a very basic or non-specific thing, but you just really know the behavior and language of your pet and how it acts in certain situations. So you can easily tell when it's acting unusual, and you can kind of create a hypothesis, and then you can go to the doctor if there's anything wrong. Alright? Secondly, don't ever let your pets go unsupervised outdoors. Especially in Pakistan, it wouldn't be much of a problem if it's not any other developed country. But here in Pakistan, there are a lot of stray dogs. So through other stray animals, it can be transferred to your pet. Alright? So never let it go unsupervised outside. Okay? After that, the same thing about water that we've covered. You already know that. So, अगर आपकी suspicions correct होती हैं, so please get your pet and yourself vaccinated as soon as possible. Thank you so much for attending this.
We used Instagram, a universal platform used daily by all target audiences, utilizing market strategies to promote our message. There was consistent posting on it. Reviews of the seminar were also taken.
It was really wonderful work, where it was research work. I'm sure that you people have also learned a lot while teaching, and you have learned now that teachers continue learning when they are teaching. Like you people were doing, you were asking questions, you were imploring, and then you were answering them yourself also. So it was a very wonderful activity. I would like to be doing on different topics and helping others also. So it's a double point, like you're learning and you're teaching. So kudos, very well done.
Thank you. We were thrilled to see the responses following our interactions.